I have one other person to thank, and that's the person without whose vision and hard work, without whose energy, none of this would have happened. That, of course, is the founder and the leader of the Kennedy Forum, the indefatigable and inspirational Patrick Kennedy, and I'm proud to work with him and hope you will join me in welcoming Patrick Kennedy.
Thank you, Bill Emmett. Honestly, you can never tell how life is going to work out. Bill was lobbying me as the NAMI state chapter leader in Rhode Island over 20 years ago as a young state representative in 1989 to be a co-sponsor of Rhode Island state parity law. And who could have imagined that when I got to Congress and the work got going on parity, that he would be the campaign chair for the Campaign for Mental Health Reform. So you had these two Rhode Islanders. I was working on the parity law. Bill was head of the national kind of coalition to help support the implementation of parity. And here we are again, my post-congressional life and his post-Capitol Hill life, and we're still working on this together. I'm really blessed to have really great relationships with people like Bill and all the members of the forum who've been helping me get this all going. Because like Bill said to you, I've had an idea, but obviously translating that idea into action takes a lot of help. And I want to thank all of you for your efforts to build this strategy out. So let me just take you back just a second and recall that, I became the sponsor of the Mental Health Parity and Addiction Equity Act as the youngest member of Congress from the smallest state in the country and in the minority party. So that should tell you a little bit about the default mode, which is, you got me by default because this wasn't a sexy issue such that I had to fight my way to put my name first on a bill that required the brain get equal coverage under in the insurance system. You can't make this up. That this day and age, we've only 5 years ago, we got the law passed, or more now, time's flying, and we're just beginning to see it implemented. So why the relevance of this effort to define what in mental health and addictions, what our agenda should look like? Because here I was, the sponsor of the parity law, and any one of you could have come to me and said, well, what's the agenda for mental health? And I would have been like, because there was no cohesive agenda that reflected the priorities of those in the mental health and addictions fields. Because God forbid we ever work together. We're we got the addictions group over here, we got the mental health group over here. They don't see each other as the same. I have to mention addictions every time I mention mental illness because otherwise people with addictions get all bent out of shape, I mean, you can't make this up. And so what we are trying to do with this State of the Union, which I think will be kind of our major annual event, we got it started last year with Dr. Satcher, and we're going to do it again this next year, February 22nd, 23rd, in Washington, D.C. It overlaps the National Governors Association. So all of us know in order to improve mental health policy, we need to do it on the federal level. In other words, we got to oversee Secretary Burwell. What's she doing? What can she do for us? Maybe if she got that disclosure guidance out, requiring that we had a better idea of how insurance companies are practicing, parity by measuring how they employ medical utilization review practices on the mental health side and compare it to how they're doing it on the med surg side. That would be a big win for us in the mental health and addictions world because then we'd be able to really monitor how patients are being treated, and are they being treated the same in the mental health and addictions world as they're being treated in the medical and surgical world. You can't know that unless you have the information on how these criteria are applied, and applied equally across the mental health, addiction, surgical, and medical. So we need to stay on Secretary Burwell with that. We need to stay on Secretary Perez, who has the authority to issue guidance of all ERISA-funded plans. That's basically the self-insured plans that represent 60+% of all the healthcare market. So my point is that if you ask people in the mental health world, what's our agenda? No one knows about what's this disclosure stuff. I mean, that sounds esoteric. But it's the key to people getting treatment, is being able to monitor this stuff. So that's kind of what we're going to be pushing. And same with the guidance on ERISA plans. And as you see from your handout, we have been very diligent about trying to build out an agenda that focuses on the 5 pillars that you will see in your folder that's in front of you. Provider accountability also has to be part of this. So not only do payers need to be held accountable, but providers need to be held accountable so that we know we can measure whether we're making progress with someone's care, because we actually track how a particular mental health or substance use disorder provider is effectively treating someone. No one knows today whether when they're seeing a therapist that they're getting better or they're not. There's no objective criteria being used. You can't make this up. So we have an agenda to put forward. It includes integration with the rest of the health system, integration with social services, technology, which is a main component of tracking and supporting people with these chronic illnesses, whether they have primary diagnosis of addiction or the primary diagnosis of mental illness. And finally, brain fitness, because if we're really to make this effective, we got to be all about prevention, early intervention, just like we would in any other physical illness. So those are the pillars. We're now building them out, and we're building an agenda around them. So what we have is a state of the union of mental health and addiction. How do we do this on the federal level, and then how do we do this on the state level? Because our event is going to overlap the National Governors Association. We're going to have governors from around the country come in. Now, why are they going to come in? They're going to come in because, as Bill mentioned, we have this partnership with Scattergood that's putting together the Parity Tracker. What the hell is the Parity Tracker? The Parity Tracker is to find out whether your state is where it stands in implementation of a federal law that guarantees all your state's residents who have addictions or mental illness, and whether they're getting treated the same as they would in another state. The only way we're going to do that is to build out a metrics state by state to effectively measure regulations, how we're doing on regulations, how we're doing on legislation, and how we're doing on case law. So I'm trying to help you understand, we're framing this out. That's my biggest beef in our whole world in mental health and addiction, is we haven't framed this. And as Bill said, we're not coming up with this out of whole cloth. We're doing it because you all have helped us fill in the missing pieces. So I want to thank all of you who have been crucial to our efforts to build out this agenda, because without you, we would not be able to put it forward. So today's plenaries and other breakout sessions are all to help build out this agenda. So when a legislator says, what can I do on mental health? We've got Plan A for you. What committee are you on? Oh, education committee? Social and emotional learning for your teachers. Oh, criminal justice system? Diversion from people with serious mental illness in the jails. Oh, healthcare? Let's divert people who have serious mental illness and addiction from the emergency rooms. Oh, how do we treat these? Like chronic illnesses and not like an acute episodic incident of care. These seem so obvious to all of us, right? So obvious. but they've never been put down in black and white in a way that's easy if you're a state legislator, a governor, or a U.S. congressman or president of the United States, such that now we will have no excuse from our public policy officials as to, well, what do I do? Well, Mr. President, here are the things that you can do. I love the First Lady's change direction. Here's how we change direction. Boom, 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 boom. You know, as I'll just conclude with this, as if we were traveling over in the Titanic, and this is the way we're treating mental health today, we're now about buying new lifeboats. That's our strategy in mental health today, because we're going to hit the iceberg. We'll just build new lifeboats. Did anyone think that maybe if we steer the ship in a different direction, we could avoid hitting that iceberg? We're at a point in history now where we can start to change course, and that's the metaphor that I think occupies all of these panels, and I appreciate everyone's effort to help us flesh this all out, and I thank you very much.